So today's session is on X-ray interpretation. I am Dr. Vaqar Bari from Radiology department working as assistant professor. I did my residency here and now it's, I think, 4th or 5th year that I am taking this session. So X-ray chest will be our main topic. So interpretation of X-ray chest. And unlike a photograph which shows you the outside, the X-rays or medical imaging show you inside. So X-ray will show you the skeleton which is not visible in a photograph. So while a photograph shows you outside, this shows you inside. So that's why it's said inside story. So plain chest radiograph is diagnostic in 80% of cases, which means that in 20% we require something additional. So additional is most commonly CT scan. It could be ultrasound for pleural effusion. So in 80%, a plain X-ray is enough, sufficient for the diagnosis. In the remaining, you may require something in addition to it. The commonest view is PA view, and I'll show you the image as well as the X-ray. Lateral could be right or left lateral. The additional views are oblique views are for ribs only. As you might be knowing by now, ribs are curved. So by doing an oblique view, the curve is gone. So you get the rib sort of straightened out. So the only purpose of an oblique view is the ribs. Apical lordotic view, I'll show you an example. It is for the apex. Expiratory view. Previously for pneumothorax, they used to do an expiratory view, but now it's sort of obsolete. We no longer require it, and pneumothorax should be able to be diagnosed on a plain X-ray. Decubitus view is when the person is lying to one side. So if the left side of the body is in contact with the couch or the bed on which he is lying, then it would be a left decubitus view. So the part which is dependent in contact with the X-ray table or couch, or even if it is a bedside, so that gives you the decubitus view. So this is the person responsible for discovery of X-rays. His name is Wilhelm Conrad Röntgen, and the year was 1895. Therefore, by the name Röntgen, it's sometimes said Röntgenogram. X-ray is also called Röntgenogram. There is an journal which is called American Journal of Röntgenology. So Röntgen is the person, and so Röntgen is also used for the X-rays, Röntgenology, study of X-rays. This is the first X-ray ever done recorded in history, and it was wife of Röntgen, Bertha Röntgen, and this was the first ever X-ray, and it's the hand, and can you see the ring? Yes, so this was the first ever X-ray in the history. So as I told you, transparent person. So transparent person could only be when you can see inside. Clinically, if you examine a patient, you are seeing from outside. Stethoscope allows you to hear the heart or the peristalsis in the abdomen or breath sounds, but you can't see, you can't image inside. So medical imaging and X-rays, first of all, then there was CT scan which was developed, then ultrasound, magnetic resonance imaging. So nowadays, sometimes instead of X-rays, it is called just medical imaging. And the densities, can everyone see air in the lung? Yes, so this is radiolucent. Do you know how why does something appear black on an X-ray? But why does it appear black? So she's right, it's less dense, so X-rays pass through. And when the X-rays reach the X-ray film, and nowadays it's not the film, it's an image plate. So one is air, the other extreme is bone. Isn't bone the whitest? So white is called opaque, and if you want the entire proper term, you call it radio-opaque. So bone is the whitest or most opaque, because it is most effective in cutting off the radiation. So it does not allow radiation to pass through as much as air would. So the bones appear white or opaque. The lungs are radiolucent or black, if you want to say in English. And can you see the heart and the chest wall? That is soft tissue. And there is a fourth density which is fat. So there could be a little bit of fat here. Can you see it's a bit grayish? So fat is not very dense. So fat also appears like air on the negative side, but it is rather grayish, not very black, because it does attenuate the X-ray beam to some extent. So therefore, fat and air are black or radiolucent. So two things are black or radiolucent. The two white ones are soft tissues and bone. And so if you are to draw an X-ray, you need four colors. One dark black, one grayish. You need one very white and less white. And metal is a fifth density, but it's not in the body normally. An orthopedic fixator, the pacemaker, ECG leads, all these are metals, but they are not part of the body. So the metals, they are even more effective than the bone in cutting off radiation. So if you ever visit fluoroscopy, or if you are attending to a patient and the X-ray team comes to perform an X-ray, if you are supposed to stand there, you are given a lead apron. So that lead apron cuts off the radiation most effectively. So that is for your own protection. So the terminologies used, I have already mentioned. Lucency is radiolucent and it is black. Opacity is radio opaque and it is white. And these are the densities. You can see the one which is more effective is white. Here, okay. So can you see the different densities as you increase? So this is very thick, isn't it the whitest here? And it's rather black here. A very thin attenuation of X-ray and it's quite lucent or black at this end. Understood? Okay. I think finger is too big, so a pen would be better. So this is one end of the spectrum, very black, most radiolucent, so this is air. And this is very thick, so this could be the bone and it is the whitest. Or if this is white and this is the bone, then this could be metal. So metal appears extremely white because it is most effective in cutting off the radiation. So that is a PA view. Why do a PA view instead of an AP view? The idea of doing a PA view is X-rays enter the back, which is P, and exit from the front, which is A. A is anterior. So isn't the heart immediately beneath the image plate or X-ray film? And isn't it very near in a PA view? So if you reverse it, won't the distance of heart increase from the film? Understood? So if its distance increases from the heart, it's going to be magnified. So you don't want the heart to be magnified. Lungs are anterior as well as posterior. So the lungs, it doesn't affect the lungs very much. Ribs are also curved. They are both anterior as well as posterior. So it's the heart which is anterior. And that is the image. That's the image which we get. And this is a lateral view. Is it a right or a left lateral? No, which part is touching the image? So this part decides. So if the left of the body is near the image plate, it's a left lateral. And for a right lateral, you would have to place the film here. So that's how a lateral view appears here. So lateral view shows you this second dimension. So on this, if you see an opacity, somewhere here you don't know whether it's anterior or posterior. So on the lateral view, you would know if it is here, it's quite anterior. If it is here, it's posterior. So it gives you the depth or where it is located in the second dimension, because this is a two-dimensional structure, but it's not represented. Depth isn't here. So by the time we get 3D X-rays, we'll have to do lateral views. But if we one day get facility for doing a 3D X-ray, maybe we could do away with lateral. Okay, so how do we start reading an X-ray? So that is metal. Can you see left? So this tells us that it's the left side. Otherwise, if the dextrocardia cases which we have in our department, they are usually wrong marker placement. So if they place left here by mistake, we would put this on the left, and wouldn't the heart be reversed? So it will appear as dextrocardia. So our cases of dextrocardia, we always call and ask, how sure are you that this is correctly placed? So otherwise, without this, we would try to place the heart to the left of midline mostly, but then we would miss the dextrocardia cases. Does everyone know dextrocardia? Yes. Okay. Yes. So heart on the opposite. And you also know situs inversus? Okay, in situs inversus, the organs are also opposite. So the liver would be on the left and spleen would be on the right. That situs inversus in which the organs are on the opposite side. So dextrocardia is part of spectrum of situs inversus, in which the heart is facing to the right and liver is on the left. Stomach is, can everyone see stomach here? That is air in the fundus. So stomach would be on the right instead of on the left. So that is situs inversus. So can you see the clavicles are equidistant from the center, which is spinous process? So if the person turns to one side, turn would be that this, if this is the film, he rotates a little bit to the left or to the right. That clavicle would go away from the midline. So that is called rotation. But preferably and ideally, we would like that it should be in the middle. Spinous process in the middle and clavicle medial ends should be equidistant at the same distance. But if the person rotates a little bit, that clavicle would go away from the midline. For example, this would be ending up here. So wouldn't this distance be more? So that would be rotation to the left, and with rotation to the left, heart would shift to the left even more. And if there's rotation to the right, then this clavicle wouldn't end here, it would be ending somewhere here. So wouldn't this distance be more? So that would be rotation to the right. And you actually try and position the person such a way that there is no rotation. But if there is non-compliance, and won't the other side reduce? When one will go away, the other will come near the midline. So it will be doubling the effect. So if 1 centimeter rotation to the right will make it -1 here, this would come nearer, and this would go 1 centimeter away. So total effect would be 2 centimeters. Can everyone see the, okay, let me first shade it. Okay, can you see the vertebral bodies? This one has been shaded red, but the one below, can you see it? Isn't it just visible, not very easily seen? And it's not invisible, it is visible, so that tells us exposure. If it is just visible, it is an adequate exposure. If they give, the technologist gives too little radiation, then too little passes through the body and too little reaches the film. That would be an underexposed film. It would be whitish sort of film, underexposed. The soft tissue and bone would look almost the same. Have you understood? It's the setting. So X-rays have to be set. If it is a child, the technologists will have different settings. And if it is an adult and someone very obese, then the setting would have to increase for that person. The same way you would increase the dose. For a child, you would give maybe a syrup, 1 teaspoonful, and for an adult, you would give 2 or even 3 tablets. So doesn't the dose increase with age? So radiation dose is also called radiation dose. So the radiation involved in producing an X-ray is called radiation dose. If they give too little, and you also know that if you don't give an adequate dose, it is not effective. If an adult requires 2 Panadols and you give half, then it won't work or the desired effect would not be obtained. So if you give too little radiation, you won't see enough. The X-rays would be less would go through the body and less X-rays reaching the film, so it would be too white. And if you give an overdose, again, you know it's harmful. Then the side effects. So if you give too much, then the vertical bodies become too nicely and easily visible, and the lungs become too black because too much radiation has gone through. So have you understood this exposure thing? It's similar to dose, and dose best example is the medicines which are given to patients, the tablets or the syrups. So you always want to give an adequate dose, not less and not too much. And then the vertical body, so if someone says, is it a good effort or it is not? So you have to count the ribs. So let me count them once for you. So do you realize every rib has posterior, lateral and anterior? So this is posterior rib, all these are posterior ribs. All these are anterior ribs. Sloping downwards is the inwards. Inwards, these are the anterior ribs. Sloping outwards are the posterior ribs. So let's count 1. I'm counting the anterior ones. 1, 2, 3, 4, 5, 6, 7. Isn't 8th going below? 8th is going below the diaphragm. It's ending here. So 7 are above. So we count how many anterior ends are above. So we'll say there are 7 ribs. 6 are required, so this person has done better than what is required. But if 6 ribs anteriorly are above the diaphragm, it's adequate inspiration.